everybody. Welcome back to another episode of ENC Health Watch. I am Jeffrey Roberts, and we are going to be talking all things women heart health again. So we are joined now by friend of the pod, Dr. Vrinda Vyas. Thank you so much. Welcome back. We're calling you friend of the pod because you're our second time guest here.
I'm glad to be here. Thank you for having me again.
Thank you so much for being here again. So we're talking about women's heart health, but also about the American Heart Association and their Go Red for Women initiative. Talk a little bit about that.
So basically, traditionally speaking, women were excluded from cardiovascular research for the longest time. So women's symptoms were not studied. What treatment works more or works better for women wasn't studied. American Heart Association is trying to fill in the gaps and get more information on how cardiovascular diseases affects women. And in order to do so, they came up with this initiative called Research Goes Red, wherein the aim of AHA is to engage community and get more women volunteers and engagement from the community to get health database started in order to help women fill in those gaps, which will help cardiovascular research in women.
Why do you think that so many women haven't been or don't participate in research generally?
For the longest time, the investigators or people who were doing these research excluded women. And that's primarily because when trials were designed, it was easier for them to deal with, as funny as this sounds, easier for them to deal with male anatomy and male physiology. So why choose women volunteers when you can easily find healthy young male volunteers and have them and investigate them.
Right.
So as a result of that, a lot of women's symptoms ended up becoming called atypical symptoms or were not studied for the longest time. And AHA has this desire to improve cardiovascular outcomes, not only for men, but also for women, which is 50% of the population, right?
Yeah.
So they began this initiative wherein Research Goes Red enables women and community members to come forward and participate in research from the comfort of their home. They don't need to donate any blood. They don't need to go to the doctor's office, but you can just sign up online. It's as easy as that. www.heart.org/Research Goes Red is a very good website wherein healthy young women who may or may not have any known diagnosis of heart disease can go and sign up and contribute to these gaps in healthcare information that we have. And help contribute to research in whatever capacity that they can.
So from what I was reading, this is kind of starting off as like a pilot program, right?
Yes. So over years, when we physicians started noticing that a lot of women were excluded from the studies and cardiovascular diseases ended up becoming disproportionately affecting the female population more. Rather, I should say cardiovascular diseases is the number one killer of women worldwide. And cardiovascular diseases kill more women than all forms of cancer combined. But when we look at the research done on women as to what causes these diseases in women, how cardiovascular disease affect women disproportionately, and how we can kind of minimize the gap, the treatment gap between men and women and get better outcomes in women. That data is just missing because no one has decided to dedicate time to that. AHA, once we recognized at American Heart Association that we need to fill in those education gaps and try to get a better idea of why cardiovascular diseases have been disproportionately affecting women and have been underdiagnosed and undertreated in women for all these years. In order to fill those information gaps, we decided to start with this pilot project wherein we're asking women whether healthy or whether those who already have known cardiovascular diseases like high blood pressure or prior history of strokes, prior history of heart attacks, anyone with any cardiovascular disease or even healthy women can participate, like I said, from the comfort of their homes by just quickly logging in and giving their consents and filling up surveys. And if they desire, they can participate in more deeper ways. But it's as simple as a click on your computer to join these groups wherein we're trying to get national database and a health registry formed,
right,
so that we can dissect that data and see how cardiovascular diseases is affecting the lives of women on a day-to-day basis.
Yeah, and you definitely want to make it like as easy as possible for people to be able to participate.
Exactly.
Right.
Yes.
Are there any like plans to push this as like a nationwide thing?
Yes. So right now, anyone across the country can go in on the website that we mentioned and log in and give consent and then start participating in surveys. What we're trying to do is we're trying to get information out there so that people know about this initiative, and then women can take in charge of their own health. And anyone with a smartphone or with a computer at home can start contributing their own data to medical research and for advancement of healthcare outcomes in women.
I think that's really cool what you guys are doing. And it's also interesting because, I mean, I instantly thought of like the phrase representation matters.
Exactly.
And like we hear it a lot and it's kind of cliche, but I mean, it is true because when you, I guess, like belong to a particular group, you start to like understand them more and advocate for them more.
Exactly.
Women are, better at advocating for women's issues better than
Absolutely.
men would be.
And, multiple times when it comes to cardiovascular research, we have seen that social demographics plays a huge role, whether that be socioeconomic status, maternal mortality is higher in areas with predominantly African American population and predominantly under poverty line population, right?
Right.
So we know that social demographics, epigenetic factors, environmental pollution, clean drinking water, so everything plays a role in your cardiovascular health. So leaving a whole section of the population out, just women being left out in research, historically speaking, has been a huge disadvantage to us, and especially in understanding why cardiovascular diseases happen in women. One more thing that is very common, that when I encounter female patients, they just think if they're young and they're seemingly healthy, they cannot have cardiovascular diseases. But we've seen genetic risk factors, familial risk factors, and also particularly speaking about women, there's a very high risk of maternal mortality, or cardiovascular diseases are the number one causes of deaths of new mothers So it's not necessary that heart disease may only develop in your 70s, 80s, or 90s. Even young mothers can have heart diseases. It can happen during pregnancy. We have certain conditions. To name one, it's called SCAD, which can affect women in pregnancy. High blood pressure in pregnancy, called preeclampsia, that can also affect moms and babies. So all of this is a part of, what AHA is trying to achieve by getting that information out there so that people can help contribute to healthcare research, which a lot of researchers and government grants have historically ignored.
Stay right there. We're going to take a quick break. Stay with us. WNC Health Watch. We are back here with Dr. Vyas. So you actually brought this up earlier, and I wanted to talk more about this, about sort of not only just women, but also like women of color also being overlooked as far as, heart disease goes, but also in like general health as well.
Absolutely. And disproportionately so, right? So we're talking about women in general because men traditionally, as much as I hate to say it, but like majority of the studies just included white men. I'm talking way back in the day, 1960s, 1970s, 1980s. Since then, we've started doing a good job of including more different diverse demographic groups.
Right.
Whether that be people of color, whether that be women, but still the data is significantly lacking. So this is something called as intersectionality, wherein you're at an intersection of being a disadvantaged group by being a woman, and on top of it, being a person of color. So these things are, it's like being at a disadvantage kind of multiplied. You know what I mean? Like pretty much at the intersectionality or intersection of being included in two historically disadvantaged groups, or groups which have not benefited from traditional cardiovascular research. So all the more important for us to include different ethnicities, different, people of color, people from all diverse backgrounds, and study them. And that's where sometimes meta-analysis or certain different kind of international databases, international health registries from other countries kind of contribute to data. What American Heart Association is trying to do is especially it becomes all the more important for women of color to come forward and kind of engage in these activities, kind of contribute their data. And that's why I would really encourage the viewers, and especially people listening to us right now, and especially if you're a woman of color, please definitely sign up for these surveys and see how you can contribute to that health lack of information and lack of data. And only by collectively, with the community coming forward and everyone coming together, can we fill in those gaps in information and get more robust information and healthcare research evidence to see what works in certain groups and what medications may not work in certain groups based on genetic factors and the socioeconomic factors we talked about.
Right. And I mean, you talked about it a lot too. It's almost as if sort of like the data that we have is, I mean, not almost as if, but, practically speaking, is kind of like skewed in, one direction. But that also can put a little bit of a strain when it's coming to, caring for somebody's health or trying to find like the best healthcare plan for them.
Absolutely. So back in the day, the procedures that used to be done for both men and women were actually studied in men. So when they started using the devices to open your arteries, to open blockages in your heart, to treat a heart attack, when they started using those devices, they noticed bad outcomes in women because the device sizing was done based on men and male anatomy. And we know women physiologically and anatomically differ from men. And that's why when these bad outcomes were observed, that's when we found out our data was lacking. It's similar to, for common people to know the crash dummies were always designed to be men. So when crashes would happen, women would get disproportionately more affected in a road traffic accident, in a motor vehicle accident. And then studies now led to female crash dummies being formed so that we can do experiments on them and know how a crash would affect a female dummy. So it's similar to that. Whenever we're coming up with new procedures or devices, it's better to nowadays it's pretty much standard of care in research to study both men and women and try to include diverse populations as much as possible, at least to get a reflective sample of the American population and see outcomes in the population.
I want to talk just like quickly about some of the actual research initiatives and some of the research happening. What's happening here locally?
Wow, a lot of new things are happening here locally. No, I can't speak for, not published evidence and not published data. So that's top
Fair
secret
enough.
right now. Yeah.
All right, stay with us. We'll be right back. Welcome back to ENC Health Watch. We are back here with Dr. Vyas. I want to talk just about some of the risk factors, but also some of the symptoms in women having, heart issues and how they're different from with men.
Exactly. I'm glad you brought that up because majority of the time we talk about heart attack and then we talk about, people clutching their chest, coming in with chest pain. It's a clear-cut sign, impending doom, chest
Right.
pain, sweating, and, classic heart attack. However, a lot of those studies, like we were talking about, were predominantly done in men. So majority of the symptoms that men came up with to the hospital commonly associated with heart attack ended up being defined as typical chest pain or typical for a heart attack. However, when women started coming up with different symptoms, like let's say tearing pain in the back, or let's say more nausea or vomiting or difficulty breathing, so shortness of breath or jaw pain, those symptoms started to be getting termed as atypical symptoms because they were never studied because majority of those studies were done in men. So half of the population, women being 50%, assuming, of the population ended up being excluded from these studies and their symptoms were labeled as atypical. However, with more information, more knowledge, and as physicians are getting and researchers are getting more attuned to these atypical symptoms, we have recognized that a lot of these atypical, quote unquote, atypical symptoms are also diagnostic and can be a measure of underlying heart disease and underlying heart attack happening.
Right.
Hence, nowadays we are taught not to ignore these symptoms and actually listen to female patients, which for a lot of history of medicine was not done the way we would want it to be. Or women, especially women of color, their pain symptoms were not adequately controlled. It is unfortunately still seen in society. A lot of people are labeled as drug seeking or non compliant. And as much as we should stay away from these labels, implicit, biases from physicians or healthcare providers can sometimes cripple in. But we have to be very mindful and remind ourselves of we don't know what we don't know. There's a
Right.
lot of evidence and information that we don't know with how female patients present with, right? Especially when it comes to cardiovascular diseases. So, being very cognizant as a physician, as an emergency provider, as an EMS, or even as a bystander, if a female were to complain of shortness of breath, it could be an atypical sign of an impending heart attack. One thing which breaks my heart, and I want to mention here, is women have been shown to get less treated if they were to have a cardiac arrest or fall and pass out. They have less likelihood of getting bystander CPR. So even common people like me and you would be more hesitant in giving CPR at a public place to females as opposed to males. And that's been shown and proven in a lot of other studies too. So women not only have traditionally been left out from research initiatives, and that's why they're underrepresented in medical research, and their symptoms are underdiagnosed, and heart disease for them is undertreated, not only by physicians and researchers, but even bystanders. CPR rates are lower in women. Now, this is a societal thing, or people feel uncomfortable administering CPR to
Right.
women, or disrobing them. There may be multiple issues to it, societal factors, but I think this is an important opportunity for me to raise awareness about that, especially when we're talking about women's cardiovascular diseases, and when we're talking about this amazing initiative from AHA, Research Goes Red, wherein we're trying to fill in the gaps in the education and research that we have for women's cardiovascular diseases.
Right. And I think that, helping out with that education is also a great point, just to help folks, help everybody out as well.
Exactly. Yeah, there should not be any, social stigma. Or if you know CPR and if you see someone in the need, someone passing out, first thing would be go check their pulse, see if they're breathing. Okay, excuse me. See if they're breathing okay. And if not, then you know the drill. Call 911, get an AED, the defibrillator if you have, start chest compressions right away.
Right.
And I know I'm digressing off the topic. This is, but I think people should learn how to administer CPR.
Yeah, it's definitely a great life skill to have.
Absolutely.
That you could, use in any situation.
May benefit you, may benefit your family members, your loved ones, or may benefit an absolute stranger.
Yeah. All right, stay right there. We will be right back. Welcome back to ENC Health Watch. We are continuing our conversation with Dr. Vyas, and we were just talking about our Go Red for Women initiative. I just want to plug that website again. It was www.heart.org/.
Research Goes Red.
Okay.
Yes.
And on that website, that's where everybody can get all the information about the different researchers that you guys are doing.
Actively going on, and what AHA is participating in, and what their data will be used for. And people, women, whether you're healthy or have known heart disease, you can all sign up. Even men can sign up if they have evidence, so anyone who wants to contribute to medical research can sign up.
Right. And I think that's really like the big picture thing that we've been focusing on during our conversation, just getting more women to participate in that research to kind of even out all the data points.
Exactly. Even the playing field out, so that we have more evidence of why heart disease is affecting women disproportionately. Why are women undertreated? Why are their symptoms not recognized in a timely fashion? And just we'll have more answers, hopefully, once we have more data out there.
Right. And we've seen, just in talking in between our commercial breaks, we've kind of started to see some of the impacts of this, and everything sort of being proportionate.
Exactly. In our everyday life, right? Like we talked about the crash dummy.
Right.
And, and then CPR dummies. We talked about the CPR dummies. Nowadays, we have more female CPR dummies too, because we want people to get more acclimatized to how to give CPR to different bodies, which may, not be just a standard male dummy.
What's been the personal impact for you in helping out with getting women to participate in research and participating in this initiative?
I have always been very passionate about women's cardiovascular diseases because when you read things, when you're more aware about, in the past, women were excluded. And as a woman, that hit me. What if I were to have heart disease in the future? I want the same level of care as my male colleagues. I want the same level of care as my male peers. What if I were to, God forbid, pass out on the street tonight? I have a lesser risk, lesser chance of getting a CPR and making it to the hospital alive. So these things need to change, especially because I feel a society cannot run if we were to treat our women as second-class citizens, right? Our women are the pillar of healthcare in the society. Majority of the time, women are disproportionately also affected with a lot of psychosocial factors and childbearing responsibility, and they put their health at the back burner.
Right.
So we want women out there to, this is such an amazing initiative from AHA, wherein from the comfort of your home, you can contribute to medical research, right? From just a click on your phone. And that research out there is going to improve eventually, hopefully, that's the dream, improve your own life, lives of your females, your daughters, lives of your sisters, and lives of your future generation, because we'll have more evidence of why cardiovascular diseases is affecting women significantly. And we'll have more evidence on what we should do about it and how we should prevent it in the future.
Final thoughts before we let you go?
I think that's about it. I'm glad that we're talking about this, and I'm glad we're trying to create, awareness out there, because, these issues are very important, and we need more common people to be aware of healthcare issues affecting, or healthcare systems affecting, disproportionately affecting women. And, just by raising awareness and having women advocate for themselves and participate in research, and just by that, we can improve outcomes. I'm absolutely optimistic about that.
And for anybody that did want to participate, just again, that website was
www.heart.org/research goes red, all small, no caps. Yeah.
no caps there. Dr. Vyas, thank you so much for joining us.
Perfect. Thank you for having me again, Jeffrey.
That does it for us on this episode of ENC Health Watch. Thanks so much for watching.